I'm going to say a few words about why it's important to do routine symptom monitoring in advanced cancer care. Well, the best and most important reason to do routine symptom monitoring in advanced cancer care is because by doing so, we learn about problems that patients are having that they otherwise would not let us know about. Very often, and in many studies, we've seen that patients are reluctant to share symptoms in the everyday common visit at the office. But if you ask them by questionnaire how their symptoms are and what they're feeling and how they're functioning, they will tell you. And by telling you, it gives you more information and advanced knowledge to be able to prevent problems like hospitalization, emergency department visits, and even decline and deterioration with progressing disease. There are studies now that have indicated that by routine symptom monitoring and managing of those symptoms that are identified as worse than a preset threshold, we can actually reduce hospitalizations, reduce hospital admissions and emergency room visits and urgent care visits, and we can also sometimes, in some cases, have an impact on survival itself. Not to mention the fact that people have better quality of life. After all, that's what I study, is quality of life, which is a compilation of various symptoms that people might have and functional abilities and their general perceptions of their everyday life. And routine checking of patient symptoms will help you as a clinician give people better quality of life. So, to say a few words about the importance of studying and measuring quality of life in advanced cancer care, this is the thing that most people care most about. Of course, everyone wants to live as long as possible, but when you sit down with people and ask them if they would like to live if the rest of their life was of poor quality, however they define that, maybe being bedridden, maybe being unable to speak or communicate, maybe having great pain, they would say no. They don't want a life that way. People want a life with quality. And so it's very important to measure that quality as we go along in taking care of people with advanced cancer, who unfortunately we know are in most cases going to decline eventually and die. And so as we think forward about why we should measure quality of life, the real reason is because quality of life to the patient is everything. It's the thing we care most about, and we would rather not have life than have life without quality. And that's as good a reason as I can think to measure it along the way in cancer care.